I've been enrolled for 9 years now. My background before was secondary mainstream, then I moved into special for a few years, and then I came to the hospital school. I'd say 9 years ago. I'm a director of the National Association for Hospital Education as well, and as part of doing this piece of work within our own school, which is 75 years old this year. We're in one of the change programme areas, Leicestershire and Rutland. So we've been able to sort of build on the work we've done previously, and actually it's been quite good. Gives a bit of momentum to push on a bit further. So I'm going to talk about our school and what we do, and particularly focus on medical needs alternative provision, the majority of which is support for children missing school due to mental health. So not exclusively, but that's most of what we do. Even since I was asked to send this presentation a week ago, and even in a week things have changed within the change program, and there's new things that we're doing. So it's been quite fast going, should we say, in terms of our development, but I think it's been productive. We'll go to about 12 or maybe 5 past, and then we'll have 5-10 minutes at the end for questions. So add some questions in the chat, and then you can ask at the end as well. Okay, so in terms of the I was in the last presentation, and Mark shared this slide in terms of the 3-tier approach to AP. So it's something that we've developed over the years, and we're doing it a bit more now as part of the change programme. In terms of our school, so we really split into 2 parts. We've got 4 provisions at the moment, potentially growing next year, but really split into 2 bits. There's hospital education, which are teaching children who are inpatients at the 2 hospitals, the Leicester Royal Infirmary, it's a big general hospital, and the CAMS inpatient unit at Glenfield Hospital in Leicester. And then we have 2 sort of our own alternative provision schools, Willowbank School, which now is Key Stage 4, and the Magpie Learning Centre, which is Key Stage 3 and early intervention. Potentially going forward, we're going to add two more of those by September next year, possibly a regional hub within Leicestershire County, because at the moment our AP is just in Leicester city centre, so children travel a long distance to get to us. And then the local authority have also approached us about having a DSP, so children with EHCPs who maybe don't need to go to a special school, but mainly because of their anxiety are just not going to mainstream. So quite a sort of niche group of students, but there's definitely a growing need. So we're thinking about a Key Stage 3 and the Key Stage 4 unit for that for September, if we can get things done in time. So it's a growing school in terms of what we do. So quickly on our hospital inpatient stuff. So we teach children at the Leicester Royal Infirmary, all ages, all abilities. Our staff team there have to be adapted, be flexible, and treat whoever's in, and try and give everybody at least 1 lesson a day, sometimes 2. So that's a great provision. It's where the school started 75 years ago, and is still sort of going very strong. The other hospital is let's say Glenfield. It's a 15-bed CAMS inpatient unit, only opened 3 years ago, or as a new build opened 3 years ago. So young people, probably aged 13 to 18, with quite complex mental health needs, who need an inpatient stay, and we've got a team of 4 there in the classroom that support them. And again, children could come from anywhere nationally to be placed in one of those beds. However, I'll focus on our medical AP work for now, because that fits more closely in with the change programme, and that's the bit that is developing. The hospital provision part is as it is, and is well settled and well established. So you've seen a a similar model to this before. I'm sure that the idea through that three-tier model is to try and do some early intervention. As a school, we found that we were doing that tertiary prevention. We were mopping up all of those children that had been out of school for so long, and they were with CAMS, and the problems were quite entrenched, and we were, to be honest, being overwhelmed. So we started to move what we do to do some short-term interventions, and then some very sort of hopefully early interventions in schools itself. So that's why we've had to do it, because we couldn't physically rescue everyone once they got to that end. You need to do more early intervention, which I'm sure you'll know about. But these are our numbers in terms of our alternative provision. Bit complex, but a few highlights. So on the right hand side there, just before COVID, we were reaching up to 80 children on roll. Big increase. We were seeking at that time for some more accommodation. We were having waiting lists, and that's the point where we started doing some early intervention work in schools. We hadn't really planned to, but really out of necessity, we ran out of space, so we had to do something a bit different and change the model. We then had COVID, which suppressed numbers a little bit, but you can see the last few years after COVID, numbers have rapidly gone up again. Last year we peaked at 97 on roll. This year we're on track to sort of match that, really. So quite high numbers. These are all medical needs, children who live at home, too ill to go to school. The majority will be mental health, but there'll be other needs in there, some with anxiety and autism, for example, quite a few with eating disorders, uncontrolled diabetes, chronic fatigue, some with long COVID, lots of different reasons, but probably not 90% mental health anxiety. So the numbers have gone up. So we needed to do something different. In terms of mental health support in schools, really, I tried to visualize when I talk to mainstream schools what that might look like. So lots of children don't need any support. Some children at the bottom there, that blue line, that support is available ordinarily in schools through the curriculum, through counselling. Schools are pretty good at putting in that level of support, and the mental health support teams that are in some schools also sort of operate at that level. If we jump to the top, you've obviously got inpatient and specialist provision where we are. What we found that schools are really struggling with was that group in yellow. So those students who needed that additional support, their mental health was becoming more complex, but they were on a CAMS waiting list. They couldn't get to CAMS, and therefore wouldn't normally meet the criteria for our school, which is what we have. So schools are really struggling with that they weren't getting support with CAMS. The mental health support teams weren't really offering support for that type of pupil, and their attendance then was starting to decline, and things were starting to escalate. So as a school, traditionally, it's probably 2 or 3 years ago, we were just operating in that tier 3 part, that those longer term placements, children who were with CAMS, they would be referred to us, and we would support them, or if they're in an inpatient unit. And what we realised as a school was that we needed to do more of that. We needed to work with schools and do a bit more early intervention work. We did not have the space to do it, and schools wanted that support. So even before the change programme sort of came along and existed, really, we'd sort of come to the realisation that we needed to do something a bit different. So currently, in terms of commissioning places, that the tier 3, the top 2 bits, that is commissioned by local authorities, and we work with Leicester, Leicestershire and Rutland. So Leicestershire and Rutland don't have their own hospital school, don't have their a big AP like we do. So they will use us. Leicestershire and Leicester, two authorities, are very similar in kind of numbers. We might get about up to 40 referrals each for those. Rutland is much smaller, so maybe up to 4 referrals per year from Rutland, and that's just based on population size and distance from our AP schools. All the other work, the tier 1 and 2 work, is either something we offer to schools free out of our own funding and our staffing, or it's something that schools directly commission with us at the moment. So as I said, we've always had the tier 3 stuff. That was what we did first. Willowbank School was our AP school, had all of our children in, and we just had too many. There was just not enough space. So by necessity, we had to do some tier 1 work. So we started going into schools to support. We would pick up the phone, we'd do that kind of support, and then we started to develop our own CPD and training offer that we deliver on our own courses, but also we can go into schools and deliver through inset days and more bespoke packages like that. And then the last thing we did was open a new centre called the Magpie Learning Centre, which is actually just over the road from Willowbank. So that helped in terms of staffing it between the two. It was a split site, but not too far a distance geographically. So that certainly helped. So that opened in September 2022, originally to take some of that capacity from Willowbank to move our Key Stage 3 group away. What we found was that at Willowbank School, we had year 7s up to year 11s. So firstly, there was a big difference in terms of their medical needs and their mental health. So the anxiety that a year 7 might be exhibiting would be very different often to a year 11 who was self-harming and showing quite risky behaviours. So in terms of having all of those children, that age range, on the same site, it wasn't great. And we also found that getting children back to school was quite difficult and remains quite difficult. But some of our younger children would think, oh, I can stay here till the end of year 11. So there was not as much an incentive to go back, because they could see a pathway for the next 3-4 years, and they wouldn't need to move. So partly moving Key Stage 3 to the Magpie Learning Centre was because we didn't physically have enough space, but also to try and break that link. So by the end of year 9, the expectation is that they have moved on to somewhere else. But as I'm sure lots of you know, it's really, really difficult to transition back to their main school, particularly if that's where the anxiety has come from. So sometimes the pathways that they will get an EHCP and then move on to a specialist provision, or they might go to a different school. And there will be some that do move from year 9 to year 10 at our school and then would remain with us. And then when we opened the Magpie Learning Centre, there was a bit of space, and we were able to open something a bit different, an early intervention package, which was an 8-week package for 3 days a week for those children who aren't with CAMHS, and that's been quite successful as well. But I'll come on to that in a minute. So in terms of our sort of 3 tiers of work, so tier 1, then the outreach work we do with mainstream schools. So we have somebody who is accredited with MHFA England to deliver the mental health first aid. So that's the 2-day mental health first aid course. It's a 1-day mental health champion course, and then half a day mental health awareness course. So actually yesterday afternoon was the first time that we ran a half-day mental health awareness course for a group of sixth form students. That particular training package is open to anyone post 16 or above. So we worked with the local school and their sixth form, and there were 25 young people that went through that training session. So they're able to be able to support their own mental health and also be aware of other people and their peers who might need support. So we'd really like to roll that out with other post 16 students and also with parents as well. So that's always changing. We do lots of other CPD and training. Again, it started during COVID. We were doing online sort of 1 hour sessions monthly, and that's continuing. Bits on anxiety disorders, anxiety and neurodiversity, supporting children with eating disorders and self-harm from the perspective of teachers and schools rather than from a clinical point of view. Excuse me. And we have we do get that quality assured by our CAMS colleagues in Leicester. They come and sit in those sessions just to ensure that's okay. But it's, like I say, it's from a school's point of view, and what can schools do to support those young people? So they've been successful. We've gone into lots and lots of schools to run bespoke sessions after school for inset days, and that continues to grow. We do open afternoons. People can come in with their problems, their case studies that they want to talk about. And then the other thing we started, I think in the summer term and is rolled over, is a hub for senior mental health leads. So we were aware that every school has funding now to send somebody to be trained as a senior mental health lead. And the feedback we got from those is they've done the training and then they would come back to school and often be isolated in they had a big workload and they didn't have somebody doing a similar job that they could talk to and bounce ideas off and just share problems with. So we established in Leicester City a mental health hub for the senior mental health lead at every school. So every single secondary school and the majority of primary and special schools have signed up. We know the named senior mental health lead for those schools, and we coordinate a hub for them, and we meet at least every half term, often a little bit more. And there's an element of sort of networking, support, problem solving, sort of discussing case studies, but also offering some training where necessary. So that's been really successful, and we're wanting now to roll that out to Leicestershire County colleagues as well, to set up another one for a different local authority. But that's a model that's gone well. A couple of things that we want to work on a bit more. Website support, we maybe want to put some more downloadable resources on our website. That's something we're working at. And then supervision for senior mental health leads. We're aware that DSLs get supervision, but do the senior mental health leads, are they offered or have access to that? So we're trying to work out how that could happen, but we think it might be useful for those schools. So that's our outreach work at the moment, but it's always developing. These are just some numbers of people that we've trained over the years. So, you know, I can't even read off my screen, about 170, I think, mental health sort of qualifications, and 500 in total that have attended ours. So, you know, it's really popular. The online sessions are, you know, cheap, really, just as cost, I think £25. We try and keep the costs as low as possible. And any income we generate through this is used to develop the mental health hub, for example, and other things. So it goes back into our work so we can expand what we do. So our tier 2, so the Magpie Learning Centre was an old youth club in Leicester, in the Ayers Monsell area. I was driving past this building for years and years and never saw it open. So I inquired with the local authority, and we got into a conversation, and they agreed to refurbish that. and allow us to move in and take that over. And so it brought back to life a vacant building that would have probably just gone into disrepair. And now we're able to support sort of up to between 20 or 30 young people every day, and that's growing. So our Key Stage 3 group are there, our longer term children, but we introduced early intervention places. So there's a 3-day-a-week group and there's a 2-day-a-week group, and they both last for 8 weeks. And the idea is from week 4 onwards that you then start the process of transition meetings, transition planning back to school. Now, from feedback from schools, we're extending the length to 12 weeks from the summer term. Really, schools felt that 12 weeks was a better period of time, and that there's more time for that transition back to school. Some have been really successful. Some who have not been back to school at all are just back full time. It's been great. Something very quick just to get them re-engaged again, and they're back in school. Obviously, some haven't been so successful, particularly where school is the barrier. So it relies on schools doing their bit as well, and really sticking to the plan that we come up with. But it's been oversubscribed. We're going to put both groups are going to be 3 days a week going forward. The bit that hasn't quite worked is the primary early intervention. For some reason, we're not getting so many referrals for primary children, and we're trying to explore what that is. Is it due to the cost, or is that the offer isn't quite right? So that's something we're trying to work with primary and local authority colleagues just to bottom out and get right moving forward. But this is something that is commissioned directly by schools. So schools, a bit like any other alternative provision, will buy a place at a daily rate for 8 weeks. And again, the costs are kept to the absolute minimum just to pay cover costs, and that's it. That's all we're seeking to do. And I spoke about opening a possible regional hub in the summer term, and that would be another one of these. Really, at the moment, our centres are in Leicester City. So if you live in sort of south west Leicestershire, Loughborough, Melton, Hinckley, all over, you're travelling a long way to Leicester City in a transport away from your community, and it costs the local authority or the school quite a lot of money. So we're hoping to open a regional hub in the southwest of Leicestershire in Hinckley. So also quite near the sort of Warwickshire, Staffordshire, Northampton border as well. So that other schools could access that if they wanted to. So that's that piece of work. And our longer term transitional placements at Willowbank School, generally Key Stage 4 students that they come to us, they're really not going to go back to school, to their mainstream school. So we'd rather spend the energy getting them in, attending them, getting them to attend a bit more, getting really great GCSE results, and then moving them successfully on to post 16. So we'd rather, for the older children, year 10 and 11, really concentrate on that post 16 transition. That's much more valuable for them, we think. There are some that come in and do go back to school, but the majority will stay and do their GCSEs with us and do really well. And they have full access to the curriculum, up to 25 hours a week if they're well enough to attend, and some will obviously build that up as they go on. But they can they might do up to 7 or 8 GCSEs, English language, literature, double science. We've got a group doing triple science this year because they're very able and that they want to do that. Maths, and then they get 2 options as well. So as well as all the PSHE and enrichment, we had a trip go out to London this week on a residential trip. We do Duke of Edinburgh now. So loads of other stuff that you would get in a traditional secondary school. It's just smaller and quieter, and maybe there's less anxiety. The impact, quickly go through that. This is a a data comparison which lots of APs had put into over the years. This last data is maybe 2022. So there were almost 5,000 bits of pupil data in there. If you just look at the mental health students, about 2,000, and then at the bottom is our school at Willowbank. So in terms of the impact, the results in terms of attainment are well above the national averages for those schools that added their data to the system. And then we just had Ofsted in October, and we were pleased we got outstanding again, which is great. The bit around, they found that our approach to improving attendance and getting them back into school is exemplary. So we have a good success rate of getting them into school, attending. Their health improves, and then they can move on successfully to post-16. The majority go on to something. One or two might not, but most do move on successfully. Nearly finished. Our last slide then, we're trying to sort of, in summary of our different pathways that we offer. So that the top one, which we do at Willowbank, that's our GCSE pathway. They'll be with us for 2 years. Our Key Stage 3, those who are with CAMS, maybe up to 4 terms. We do want to try and push them back to school or move them on to somewhere else more permanent if we can. For some, it's more realistic than others. Our Engage pathway is that early intervention offer, 12 weeks, 3 days a week, get them back into school. That's for the children who aren't with CAMS. The Nurture pathway, Key Stage 2, that's the thing we need to work on. It isn't really up and running. It hasn't really worked. So we're looking at that again. And the EHCP pathway is the new provision, hopefully from September. And that's to support the LA with those particular children. And I think that's the end of that. And I feel like I've gone through very quickly, but it is only just 12 o'clock, so it's perfect time really. So I'm going to stop sharing. Presenting. There we are. And we've got what, about 7 minutes or so for questions. So I haven't read the chat because I've been talking, but right. So Clara, you've got your hand up. So
hi, apologies for my camera not being on. I mean, your model sounds fantastic and really exciting to hear about. I just had a question about some of your tiers where you talk about young people being open to CAMS. Do you have any requirement additional to being open to CAMS in terms of being medically signed off at all to access any of your pathways?
Oh yeah, so just for those the tier 3, it's our school criteria that yes, they would be with CAMS or with a paediatrician level if it's a physical health, but yeah, they're not attending school due to anxiety. So just because you're with CAMS, that doesn't mean that you would need a place. If you're attending school, even if you're attending your mainstream for 3 mornings a week, we would encourage schools to carry on with that. So it's really that they're just not attending at all, and are at CAMS level, and the CAMS or the medical support specifically says they need a smaller alternative provision, and mainstream for now isn't suitable. So yeah, it's those kinds of things.
Thank you, that's really helpful.
Okay, Julie.
Hi, thanks. Very useful presentation. I work a lot with our Manchester hospital school, and I know that one of our issues is parents going to GP to get the requirement to have some kind of medical evidence to support a school's referral into our hospital school or work with our hospital school. And because GPs are so overburdened already, it tends to be that they're not doing a full assessment of needs, and taking parents say so for, you know, for the fact that the child needs to be referred to the hospital school. So I just wondered if you've got any sort of solutions or comments around that.
No solutions, I'm afraid. But so that really would fall back to our local authority. So we some hospital schools or medical APs, they address all of the Section 19 referrals for the local authority and just do absolutely everything. We don't. We would have those who are with CAMS. Otherwise, we would just have too many. So that in Leicester City, well, and Rutland and Leicestershire, they have their LA medical needs panel. So I guess children at that level where they're getting requests through would go to the LA first, and then that they might then get referred to us if they felt they meet our criteria. But the local authority is around us. Sometimes we'll go back to school with their own checklist saying, you know, you need to do this first. We want to see that, you know, what have you done already? But I know, like Leicestershire County, they have their own practitioners, wellbeing practitioners, that they might put in first to do some work, and then if that doesn't work, they might put in their own provision, home tuition, that kind of thing. But it's a common problem, I think. But for us, that would be the local authorities doing that, and then because they commission us to do that work at that level, we would only do that. But it is a problem. I know there's a lot.
Thank you. Yeah, we do have a Section 19 panel, which the school and the we have medical reps on there as well as the local authority. But yeah, it's an issue. Thank you.
Yeah. Hi, Lorraine.
Hi, Steve. Good to see you.
Yeah.
It's nice to hear how things are changing, and you know you're seeing what's right for the children, and you know, driving past the Magpie and then creating a whole new service. That sounds brilliant. But I was wondering around how do you move your workforce and get the right workforce across the different sort of services? Do they go to different places, or do you keep them in the same sort of building, or how does it work?
Yeah, I think it's evolved over the years. I think going back, you know, way before my time, that the different schools or the different provisions just worked completely in isolation. I don't think they spoke to each other. And then my predecessor changed that and got everybody together to work as one school. It was probably a bit too much movement, so people were, you know, all over the place. So we tend now that the two hospital teams, that they tend to work together. There's a little bit of shared working between them, and that's how we can get for example, our secondary specialists to work. So the science teacher will be 2 days at the hospital and 2 days at the CAMS unit, and the same with English and maths. So the two hospital teams, inpatients, they tend to work together. And when we started the Magpie up, it was teachers from Willowbank going backwards and forwards, and it is only it's a 2-minute, maybe 5-minute walk across the road. Now, as it's grown, we've been able to establish a core there, so there is a little bit of crossover, but there's more of a core team there, because we found if teachers were popping over for an hour to do a lesson, then going home again, that, you know, that pastoral care, that nurturing kind of stuff that you'd normally have in a school wasn't really there. That you weren't able to build the relationship. So there is a bit of crossover, but there's definitely a core team at both centres just to provide that bit of stability and for the students as well.
Yeah, that, and working with the same people, continuity, that sounds great. My second thing was going to be, how much support, I know we talk about this often, but how much support do you get from the health colleagues that are around you and in the local area? So, you know, for example, speech and language therapists and stuff, how much connection is going on between the services?
Well, I would say as part of the change programme, it has facilitated those conversations. So it has got better. I mean, speech and language, we don't really have anything. Well, we don't have any contact with those. occasion with occupational health and physio, we would do if we get a particular child. I mean, CAMS, I suppose, is our biggest connection, because all our children will have a CAMS worker. So we have good conversations with them, and that is starting to improve. So so we've built up a good connection with the is it the intensive community care teams? I might have got that name wrong, but you know, the team that's tasked with trying to keep children out of the inpatient CAMS unit. So that we've started to have a relationship there where they want to understand, you know, how we work, and we obviously want to know how they work as well. So it's getting better.
It's building.
Yeah, and we're trying
You've got to
to
start somewhere, haven't you?
Yeah, these AP strategic task forces, force that they've been piloted mainly in sort of, I call them sort of behaviour proofs, and that's not always the same, but there's nothing really for medical needs. So that's the bit we're really trying to work. I mean, we have our own art therapist and family support worker and youth worker. So it's just trying to build that team, and what could it be really? But that is definitely an area for work. Connections with health.
Okay. Thank you.
We
Kate,
have one more question from Kate. And
do you want to come in, Kate?
Apologies, I put my hand down because I was conscious of the time, and I don't actually have
right.
a question. I just wanted to clarify my comment in the chat to say that question around you know, medical evidence and where you've got GPs writing a letter, and I was just pointing out some case law around it, because obviously what you're always looking at is their education reasonably accessible, but it's just to clarify where you get a letter, and we get situations where the parent might have just spoken to a GP and the GP literally just regurgitates what the parent has said. We would consider the weight of that as actually they've not seen the child, they've had no kind of sort of evaluation of the child. We would then look at what other evidence there was, whether there was mental health professionals involved, etc. So we don't use it as a barrier, but it is worthwhile knowing that the weight of what weight you give the medical evidence depends on sort of the quality of the evidence. It was just to explain that a little bit more, but it sounds great what you're doing, Stephen, and lots of overlap with what we've got in place in Lincolnshire, but lots for me to take away, so thank you.
Yeah, thanks. And you know, part of the change programme, I'm chairing the AP work stream with somebody from Leicester Local Authority who is sort of leads the SMH team as well. So we're really trying to improve what we do, get that overview of AP across the whole authority, and where are the gaps, and what can we do, and in terms of commissioning, who does, you know, what does tier 1, 2, 3 look like, who pays for it, can we reprioritize funding because there's no new funding, and that kind of thing. So it has been good to work with the local authority and with health and other partners, and I suppose the change programme has pushed us to do that where maybe we wouldn't have done that before. Well, they sort of pushed us together really, which so it's been good. We've been on the journey, and this is given a little bit more of a kick up the backside. Right, let's carry on. We're going down the right route. Let's carry on with this really. So okay, I think hopefully the presentation will be sent out. I'm sure if anyone wants my contact details, then somebody at CDC will pass that on. But you know, anytime, just if you want anything else, then just let me know. So okay, I'll let you go now. Have a quick break before you've got 6 minutes to the next one. So all right, thank you everyone.
Thanks, Stephen. Cheers. Bye.
Okay, bye.